Most people assume that when you walk into a doctor's office, you're talking to someone who's been deeply trained in every aspect of health, including food. The wild thing is, that's not true. For decades, most doctors have gotten almost no real education in nutrition, even though diet is driving so much of what we now call modern disease. And I felt the consequences of that gap in a very personal way during my health journey, and today we're going to dive into why that is. Welcome to Wild is Wise. I'm Sara Estes, a former private investigator who ditched the high-stress legal life after a major health crisis. I rebuilt my health from the ground up through nutrition and functional medicine, and now I'm here to uncover the truth about women's wellness and translate it so you can make informed decisions about your health. On this podcast, we break down women's nutrition and physiology with real research and actionable tips. And here's the core philosophy. What's found in nature is often exactly what our biology is wired to thrive on. We get nerdy with the science, but keep it practical for everyday life. If you're ready to understand what your body actually needs, you're in the right place. As always, this podcast is educational, not medical advice. Please talk to your healthcare provider before making any changes. Let's jump in. Today, we're diving into something that most doctors never learned in medical school. How food actually shapes your hormones, your metabolism, your gut, and your long-term health. We're going to talk about why nutrition education has been almost completely absent from a lot of medical training, how that gap affects the advice you're getting, and what you can do about it. And we're going to do that without turning this into a doctor bashing session. That is not my goal. My goal with this episode is to give you context and language so you can understand that gap and feel more confident speaking up and advocating for yourself in your own appointments. This was a huge lesson for me to learn during my health journey, and I'll share pieces of that story as we go so you can see why this has become such a personal hill for me to die on. Quick trigger warning here, my story does include multiple pregnancy losses, and that's part of the conversation. So if you're not in a place to hear that right now, then protect yourself, protect your nervous system, and go ahead and skip to the next episode. Let's start with the stakes. In the United States right now, diet-related diseases, things like heart disease, type 2 diabetes, and many cancers are the leading cause of death and disability. The leading cause. At the same time, when researchers look at how much nutrition training doctors are actually getting, the numbers are almost unbelievable. A 2024 analysis found that 75% of U.S. medical schools have no required clinical nutrition course at all. Only around 14% of residency programs require any nutritional curriculum. Surveys of medical students and residents show that many of them report fewer than a handful of hours on nutrition over their entire training, and some report essentially zero. So when you sit in an exam room and you ask your doctor about food, what you're really doing most of the time is asking a highly trained expert in pharmacology, diagnostics, and procedures to speak on a subject they were barely taught. That doesn't mean they're not brilliant or they don't care. It means the system didn't equip them with that tool. And that's not just an abstract problem for some policy paper in Washington. That gap shaped the exact advice I got, or didn't get, over 3 of the hardest years of my life. During my fertility journey, I had 3 major surgeries in less than 2 years. I had an emergency gallbladder removal, a fibroid tumor removal, and a DNC after recurrent miscarriages. I went through 3 pregnancy losses in a single year. I did endless labs, ultrasounds, genetic tests, and consultations at one of the top fertility clinics in Nashville. So there were a lot of white coats, a lot of very sophisticated medicine, but what there was not at any point was a real conversation about food, digestion, toxins, or nutrient density. During that time, no one ever sat me down and said, hey, have you been extremely anemic? Your periods are heavy, your stress is off the charts, you've had your gallbladder removed. Let's talk about what and how you're eating. No one explained what losing a gallbladder meant for fat digestion, for bile, for how I should support my body after that surgery. I was literally told, you don't need it anyway, hold off on spicy foods for a couple weeks, and then just live your life as normal. And I was sent home. Through 3 miscarriages, not a single person on my medical team suggested experimenting with diet, removing certain exposures to toxins, or looking at nutrient-dense foods as part of the plan. Not even as a complement to all the testing that we were doing. The pattern was always the same. Test, scan, diagnose, operate, and when all of that didn't give us answers, the next step was straight to IVF. Now, IVF is a very expensive, often traumatic process, $40,000 or more, intense hormonal stimulation, and in my particular case, a single-digit chance of success. And that was suggested before anyone asked about my nutrition or my environment. At that time, I didn't have language for it, but what I was bumping into was exactly what the research is now describing. It was a system built to manage disease with procedures and pharmaceuticals, not to use food as a first-line therapy. Once I learned the numbers that roughly 3/4 of medical schools don't require clinical nutrition, that only a small minority of programs meet the long-standing recommendation of 25 hours of nutritional education, it suddenly made sense why my experience looked the way it did. My doctors weren't ignoring nutrition out of malice. They were simply practicing exactly what they had been trained to do. And it's not just my story that confirmed that. A few months ago, I was at a nutrition conference. We were standing there surrounded by all of these incredible nutritionists and functional medicine practitioners. Shout out to Restore Your Health Minicon here in Nashville. But I was talking to a woman and her husband had just finished medical school. And she told me that he went through 4 years of medical school and got almost no training in nutrition. That was another light bulb moment. This isn't just statistics in some PDF or on PubMed. It's actually happening in real time to the next generation of physicians. So what exactly are doctors learning and not learning about nutrition? Most medical curricula include some basic biochemistry and maybe a few lectures on vitamins and metabolism, but that's very different from learning how to use food patterns to treat real patients. A 2024 National Institutes of Health linked review described it like this: nutrition education in medical training is often fragmented, optional, and largely theoretical with minimal hands-on clinical exposure. Some schools hit that recommended 25 hours, many don't even come close. And remember, residency, the part where doctors actually learn how to practice, is even thinner on nutrition. Only about 14% of programs require any formal nutrition curriculum at all. So what does that mean? That means your average physician is deeply trained to recognize disease and to interpret complex labs and imaging and prescribe the right medication or procedure. But they may have had less nutrition training than the average wellness-obsessed podcast listener who's read several books and listened to functional medicine episodes. And again, this is not blaming individual doctors, but it's about seeing the limits of the toolbox they were given, which is why I'm so passionate about helping women understand their own health and to understand how nutrition affects their body, because it is our responsibility in many cases to advocate for potentially simpler solutions. For me, the real emotional turning point came after my third miscarriage. I was sitting in an exam room being told, once again, we don't really know why this is happening. Your labs look normal. All the tests look normal. The next step is IVF. And I remember having this realization that if I keep going down this path, the only tools anyone is ever going to offer me is more surgery, more hormones, more procedures, and it's just going to continue to escalate. No one is coming to rescue me with a conversation about food or to offer potential simpler solutions. That is when I started becoming my own advocate in a very real way. I started digging through research papers, joining forums, and asking for specific tests instead of assuming that the medical system would automatically look under every stone. I asked for clotting panels, immune workups, all the things, and in many ways, they came back normal. It was both reassuring and infuriating because it meant that we'd exhausted the conventional playbook and I was still without a baby and still without answers. So at that point, I had a big paradigm shift. I realized that medical doctors are trained to treat you with medicine and procedures, and nutritional professionals are trained to heal with food. Those are two completely different education tracks, and I'd been expecting one track to give me what only the other was equipped to offer. So I did something that I should have done much earlier. I hired a certified nutrition practitioner, and for 3 months, we completely overhauled everything. I shifted to an all-organic, whole foods diet as much as I could realistically manage. I cut out processed foods, I cut out coffee, alcohol, and as many other toxins that I could identify in my home and personal care products. We cleaned up my supplement regimen. I moved away from random gummies and all these shelf-stable synthetics into higher quality prenatals and whole food-based support systems. I started taking targeted supplements like ox bile to compensate for my missing gallbladder, which was something that no doctor had ever mentioned, even though the gallbladder is central to fat digestion. And I brought in nutrient-dense bioavailable foods like beef organ supplements because I finally understood that it doesn't matter what's on the label if your body can't absorb it and use it. Instead of piecing together isolated compounds and isolated vitamins, I was giving my body concentrated whole food sources of things like vitamin 12, heme iron, vitamin A, and choline that directly support red blood cell production, hormone metabolism, and cellular energy. Now, let me be clear, those 3 months were not easy. It's not easy to eat all organic, super clean, no coffee, no alcohol. It took vigilance to read every label and cook more and to swap out products, to live what people are now calling a low-tox lifestyle. Not a perfect lifestyle, just one where I reduced what toxins I could control. But I noticed that my energy was shifting, my cycles stabilized, and a sense that my body was finally being given the raw materials it needed instead of just being pushed and prodded. Just a few weeks after we finished that 3-month reset, I got pregnant again for the 4th time, and this time I carried my daughter, her name is Nova, to term with a healthy pregnancy. I don't believe there's ever one single cause or one single fix in a complex journey like fertility, and that goes the same for cancer journeys and weight loss journeys and other health journeys that you may or may not experience in your life. And I'm not saying eat organic and take beef organs and everything will magically work. What I am saying is that nutrition and environment were the biggest levers no one had ever mentioned to me in the 3 years of highly medicalized care. And when I finally pulled those levers, my story completely changed. What's fascinating is that while all this was happening in my personal life, the system itself was starting to wake up to the same reality. In August of 2025, federal health and education officials issued a public call for a total overhaul of nutrition education in medical training. This is huge. The HSS announcement urged medical schools, residencies, and even pre-med programs to integrate comprehensive nutrition education across the entire training pipeline. Not just as an elective or a side seminar, they called nutrition foundational and pointed out that it's impossible to tackle the country's burden of diet-related disease if the clinicians on the front lines aren't trained to address food in a meaningful way. Incredible. Major organizations applauded the move and emphasized how little practical nutrition training most physicians currently receive. The American College of Lifestyle Medicine, which has been sounding the alarm about this for years, called the HHS guidance urgently needed. And they pointed out that nutrition is evidence-based medicine. It's not a fringe topic. Even the AMA has backed efforts to push more nutrition training into medical schools. So we're in this interesting moment where, on paper, the system is starting to admit the problem. We can't keep graduating doctors who aren't trained in how food affects disease and then expect them to solve a crisis that is largely driven by diet. But curriculum change takes years to filter through. And if you're listening to this right now, you probably don't have time to wait for the next generation of doctors to graduate. So what do you do with all this? The first thing is to shift your expectations. When you walk into an appointment and your doctor doesn't spontaneously bring up nutrition, it may not be because they don't care. It may be because they were never trained to see food as a primary tool. That doesn't mean you shouldn't ask. It means that when you do ask and you get a superficial answer, you don't stop there. You recognize that you might need a second kind of expert, just like I eventually needed a nutrition practitioner alongside my OB and my fertility specialist. You can absolutely bring nutrition into the conversation in a respectful way. You might say, I know food isn't the only factor, but can we talk about how my diet might be affecting this? Or you could say, is there someone on my care team, a dietitian or a nutrition literate clinician that you recommend I speak with about the food side of this? Sometimes your doctor will have a great referral, and that's wonderful. Sometimes they won't, and that's information too. You can also give yourself permission to build what I like to think of as your own personal health board. Your primary care doctor or your specialist is one seat at that table. A registered dietitian or a well-trained nutrition practitioner can be another. And maybe you have a therapist, maybe a body worker, maybe a coach. The point is not to replace medicine with nutrition or replace nutrition with medicine. It's to stop expecting one track to do everything. For me, one of the most empowering shifts was realizing that I could treat nutrient-dense bioavailable food as legitimate medicine. I could see superfoods like kale and berries and the supplements I was taking, like beef organ supplements, not as some quirky wellness trend, but as a dense, efficient way to get heme iron, vitamin B12, vitamin A, and choline in forms my body actually uses, especially during seasons like perimenopause or fertility, where those nutrients are under high demand. I could see organic whole foods and reduced toxin exposure not as a moral purity project, but as a practical way to lower the burden on my liver, my hormones, and my immune system. If no one has ever told you this before, it is absolutely okay to ask your doctor how nutrition fits into your condition. And it's absolutely okay to seek out additional support if the answer you get is, well, we don't really do that here. You're not being difficult. You are working around a curriculum gap that you didn't create. When you hear the phrase, doctors never learn this in medical school, I want you to remember two things. First, that statement is literally true for many physicians. The data are very clear that nutrition has been largely absent from their training and is only now being pushed back in. Second, you don't have to wait for the system to fully catch up before you start treating food, environment, and nutrient density as powerful tools in your own life. I walked through 3 years of intense fertility treatment with no one ever mentioning nutrition, and I will never get that time back. That's why I'm talking to you about this now, not to scare you or to make you distrust every doctor that you see, but to shorten the distance between where you are right now and the moment where you realize, oh, there's another lever I can pull in this. There is hope. You can honor what modern medicine does brilliantly: diagnostics, acute care, life-saving interventions, while also insisting on a seat at the table for food, nutrients, and daily habits. You're allowed to ask, you're allowed to learn, and you're allowed to build a team that sees the whole picture. Whew. All right, that's it for this episode of Wild is Wise. Thank you so much for listening. As always, I'm here if you have any questions. Please feel free to DM me on Instagram if you have any questions or you want to chat about this. If any of this resonates with you, I'm always open for conversation and I love to hear from you. The handle is @WildIsWise on Instagram and TikTok. Until next time, stay wild, stay wise. I'll see you next week.